The federal government announced its latest contracts for vaccine. They're investing $173 million in the Quebec-based Medicago to develop their vaccine and to build a large plant in Quebec to produce it. Medicago has agreed to supply 76 million doses to Canada if their vaccine candidate is successful. The government also announced an $18 million investment in Vancouver-based Precision Nanosystems. It offers technology to produce vaccines and therapeutic drugs. So far, the federal government has secured 358 million doses of promising vaccines. The Prime Minister warned Canadians, though, are still in for months of waiting before a vaccination campaign begins. For more on this, we reached Health Minister Patty Hajdu in Thunder Bay, Ontario. Minister Hajdu, welcome back to the program.
Thanks so much, Catherine.
The Prime Minister said today that Canadians should not expect a vaccine before the end of the year or for the beginning of 2021. Should we conclude then that mid-2021 is our best case scenario?
Thanks for the question. It's the question I think I get asked the most frequently, which is how long? How long are we stuck here living with COVID-19? And I think, listen, we're very hopeful. I've had regular conversations with the vaccine task force, and, they're very hopeful as well. We've got 3 vaccines that have submitted to Health Canada for what's called a rolling approval, meaning that they'll submit information, clinical information and other information as they get it, which will accelerate our ability to assess those vaccines. But I think the Prime Minister's right when he can say with confidence it won't be likely this year. It'll be hopefully in the first quarter or second quarter of next year that we'll start to see vaccines unfold across the country.
He also said today that there are not going to be enough doses for everyone at first. He said that the most vulnerable and frontline workers will go first. Should we understand that everyone else will be asked to wait?
So that's exactly the work that's happening right now with Health Canada and with the Public Health Agency of Canada and with an advisory committee that's actually a national independent advisory committee on immunization that gives advice around vaccinations. And in fact, that's the kind of advice that we'll expect them to release shortly is interim guidelines about how to prioritize vaccines. And yes, he's right again, there will be a prioritization likely of groups that are more vulnerable. So for example, you can imagine elderly people, people in nursing homes, healthcare workers, those with underlying conditions, etc. And the intent behind that is, of course, to protect the most vulnerable the most quickly. The other aspect of this is that not every vaccine will work for every population. So that work is happening right now in terms of how we unfold a vaccine program that gets at our goal, which is allowing Canadians to feel more confident that they can manage COVID-19 in their communities and be less at risk of contracting it themselves.
I'd like to switch gears a bit and talk a little bit about this motion that the Conservatives have put forward, requesting a broad swath of documents related to the government's handling of COVID-19. Your government has, you certainly haven't jumped for joy, let's say. There's been some resistance, I think we can fairly say, in regards to that particular request. And so I'd like to play a little bit of tape for you.
The Liberal government is committed to openness and transparency.
We will succeed when we deliver an economy that works for the middle class, when we make government open and transparent by default.
We have publicly and privately and in every possible occasion emphasized that our government will behave in an open, transparent, responsible way.
I have been open and transparent about that.
We have been open and transparent with Canadians on the facts.
We're going to continue to be open and transparent with Canadians, and that kind of transparency is just what Canadians expect, and we'll be working with Canadians on that.
How can your government have spent years talking to Canadians about openness and transparency, and yet you are not saying now that you will try to find a way to release as many documents as possible?
Well, in fact, I think the premise of the question is wrong because I think, my understanding is that MP Rumpel Garner has, in fact, introduced an amendment that gives the government adequate time to produce the documents that she's requesting.
This is the 30, she has said 30 days. Sorry, I don't mean to interrupt, Minister, but I want clarity on what you're saying here. She has said 30 days. You're saying that's adequate.
I'm saying that those are still under negotiations with the House leaders, and I don't want to presume the conversations that they're having. But
you said adequate, so what is adequate?
So Listen, I will say this. It is important that we understand the scope of the documents that she is requesting all at once. And the original motion asked for them in 15 days. My concern is I have, of course, officials in both departments that are responsible for producing documents. And then I have officials in both departments that are responsible for responding to a variety of really urgent issues related to the pandemic, whether it's supporting local public health to deliver additional Canadian Red Cross resources, or helping with testing and contact tracing, making sure that we're actually approving testing devices and moving forward on regulatory processes. And I want to make sure that whatever we ask the departments to do does not distract them or take their time away from what I think Canadians are expecting us to do, which is help us get through this next wave of the pandemic.
But surely parliamentary scrutiny is an important part of how Parliament deals with this enormous issue of the pandemic.
Absolutely. And I think our government has been clear to say that we will be there. We will respond to requests to appear before committee. We will provide documents. I will also point out that all of the data that we're gathering from provinces, territories, and our own processes are available on our website at canada.ca/coronavirus for people to monitor live time what's happening, for example, on regulatory reviews of devices, all the way to what kind of test positivity rates we see across the country. That transparency will continue. It is critical that Canadians have access to information they need. It's critical that Parliament does. But I think, what we want to be able to do is to do this in a reasonable way that allows departments to do this and not remove the focus from what I believe is the most critical to Canadians, which is making sure we have the tools, the expertise, the research, and the support for provinces, territories, and in fact, local public health to be able to contain the virus and protect Canadians' health.
And yet, Minister, your critics have pointed out that in the past few months, your government has prorogued Parliament, you've filibustered committees, you have in fact threatened dissolution last week, earlier this week, I should say, by making the issue of the documents surrounding the We Charity a confidence measure. So I want to understand, you are speaking right now very positively, it seems to me, about the negotiations that are going on. You used a moment ago the word adequate to refer to the changes that Ms. Rempel-Garner has suggested. Are you committed to finding a solution to releasing as many documents as possible?
That's exactly what I said in the House yesterday. I said that, look, Health Canada, Public Health Agency of Canada will provide documentation, will work with Parliament, work with the committee, the Health Committee, to appear before committee. We always have, to be clear. I mean, listen, I have provided testimony personally at the committee a number of times. So has Dr. Tam. So have a number of other officials on a variety of different subjects. None of that will change. The concern that the government had yesterday with the opposition motion was the scope was really, I think, designed to make it difficult for the government to respond. And quite frankly, I think divert attention away from our immediate concern, which is making sure that Canadians, again, have what they need, no matter where they live, to protect them from COVID-19.
You say designed to make it difficult for the government to respond. You are suggesting ill will on the part of the Conservatives with this motion? Which they say is about scrutinizing the most pressing issue. I think you both agree, all parties agree, facing, not just this government, this country, but the world right now.
Listen, I'm saying that 15 days to produce the volume of documents that the opposition knows they were requesting would present serious concerns to me as the health minister in terms of my departments, the departments I'm responsible for, their capacity to be able to do so in compliance with the motion. And so we want this goal to succeed. If the Conservative Party is truly getting at being able to review the response, so as the member opposite says, we can learn from it and adjust our response going forward, then let's do it in a way that respects the hardworking officials who are, I would say, working around the clock to ensure that Canadians have what they need as we move forward in the next stage of this pandemic.
I want to ask you as well about long-term care homes and a report that's out by our colleagues at CBC Marketplace. They took a look at Ontario long-term care homes. They looked at 21 of the most serious violations. Of the 632 homes in the Ontario database, 85% were found to be repeat offenders. Does that number surprise you?
Sadly, it doesn't, especially after what we saw with the Canadian Armed Forces reports that came out in the spring about the conditions in long-term care homes that they had been asked to help out in. And from my own experience, visiting long-term care homes as a member of Parliament, certainly just seeing how vulnerable people are in those settings. So it's sadly not shocking, which is a real, I think, statement about how much work we have to do on improving conditions for seniors in long-term care homes.
Will that work include continuing to pursue national standards for long-term care facilities with the provinces and territories? Is that still on the table?
Absolutely. As a matter of fact, I just spoke about this today with my counterpart, Minister Schultz, who is, as you know, the Minister of Seniors, about the urgency of doing this and doing, this with provinces and territories, but also with a sense of urgency, because these kinds of reports, they're not just numbers. And I know the numbers in themselves are shocking, but these are individuals, these are loved ones that are at this moment in care homes that are, at the sort of in the worst scenario, abusing long-term care home residents. And, those reports are shocking for everyone, and everyone should be standing to attention, including the provincial ministers who are responsible for their long-term care systems. I mean, take a look at Ontario, for example, moving away from an annual inspection regime to a complaint-driven regime has had devastating outcomes for families and people in those homes.
Our time is very much up, Minister, but I still want to know when. I mean, you say urgency for these standards. What are we talking about? Could they be in place in a month, for instance?
Well, I think, when we talk about long-term care standards, that's a longer project. But I think, again, we do have the national guidance that I think it would be incumbent on all ministers of long-term care, all ministers responsible for long-term care, to take a look at and to action immediately. Because as we're in the second surge, we can see that deaths are climbing. And guess what? They're climbing again amongst the same population, which is people who are elderly, often in long-term care. And what that's an indication to me.
But you're saying a longer project, so you're saying months and months for those national standards, despite what you're saying about the urgency.
Permanent long-term care standards have to be negotiated with provinces, territories, and of course the stakeholders that are responsible for implementing them. But what I'm also saying is that we can't wait to take action in long-term care for the length of time that it would take to get to those standards. The Safe Restart agreement with provinces and territories included $700 million to provinces and territories to improve their infectious disease processes and to make the changes necessary to protect seniors in long-term care homes. And I would urge them to use that money rapidly to do exactly that as we work on this larger project together.
Okay, they are important issues. Thank you for taking the time to talk to us about them today, Minister.
Thank you so much, Catherine.
Minister Patty Hajdu seemed to indicate that the government is willing to provide documents related to the pandemic response programs, but she says she's still concerned with public servants' time being eaten up serving committee document requests. Are the opposition's demands reasonable? Let's ask the power panel. From west to east, columnist for the Winnipeg Free Press and associate professor at the University of Manitoba, Nigan Sinclair, is in Winnipeg. Maclean's Paul Wells is here in Ottawa. Marie Vastel is a parliamentary correspondent for Le Devoir. She's in Gatineau. And in Montreal, Marty Patriquin is the Quebec correspondent for The Logic. Welcome back, everybody. Marie, I'm going to start with you. This has been an interesting discussion to cover today because there seem to be some signs of willingness, I guess I'll say, from Minister Hajdu in that interview. At the same time, when I talk to other Liberals, the indication that I'm getting is that there are still plenty of concerns. These negotiations are going to continue through the weekend. What is your sense of where this debate is going?
Well, I thought your question off the top was interesting. Is it reasonable? I think that would probably depend who you ask. Yeah. I'm pretty sure both sides think they're being reasonable. I don't think anyone is questioning whether the opposition should be asking these questions. They are very fair questions. We're in unprecedented times. And there were questions raised at the beginning of this pandemic as to whether we had enough PPE. There are still questions raised now as to whether we're doing enough to get rapid tests, to get vaccines pre-ordered. These are all legitimate questions, but I do think when you looked at the text of the motion, one could wonder if it was realistic. they are asking for, memos, notes, emails, documents between PMO, PCO, the health minister's office, the public health agency, sometimes the public safety minister's office, sometimes the procurement minister's office. Some of these documents, so it ranges from what we talked about, PPE, vaccines, whether the alert system was sufficient or not. And some of these documents would go back to January 2018 in one of the categories. I think asking for all of this in 15 days was maybe a little ambitious, knowing that these bureaucrats have to go through all these documents. They have to find them, they have to translate them, they have to get them all ready. I do think one could reasonably think that it might have been a bit too much to do in that length of time. I actually still don't understand how the government thinks they can do it in 30 days, given we know how long it takes for other access to information requests to take. But if the government thinks they can do it in a month, great. I do hope the government shows openness to actually acquiesce to these demands, because they are questions that Canadians are asking themselves. I just think maybe both sides need to sort of play ball, if I can say, recognizing on the one hand that they're asking for a lot of documents, and recognizing on the other hand that they should be transparent and tell Canadians how prepared they were and how prepared they are now.
Paul, this has been such an interesting week in a way, because on the one hand, there's so much process, I think this week in particular. But on the other hand, I think you can make an argument that the issues at play are enormously important. And so I suppose my question to you is just, does this matter? Does this debate that we're having right now, is this an important debate in your view?
Yeah, I mean, one of the things that makes it an interesting debate is that, at least to me, it's not obvious that one side has all the right and the other side has all the wrong. The opposition is engaged in a massive fishing expedition here. Mm-hmm. They're looking for anything they can find that will make the government look bad. Unfortunately for the Liberals, each opposition MP is as legitimate as each Liberal MP. They were all elected, and there's more of the opposition MPs than there are the Liberals. I would remind this Liberal Party that we're not too far distant from the time when a Liberal opposition voted a Conservative government in contempt of Parliament for refusing to hand up documents pertaining to fighter jet procurement. This is back in the old days when the Liberals cared about fighter jet procurement. Couldn't resist. And it's also true that when nobody is watching, this government tends to cut some procedural corners. We saw that in the We episode. We saw that in the SNC Lavalin episode. So I actually don't think this file is progressing badly. The government is going to cough up more information than it really wants to. The opposition's going to have to wait longer than it really wants to. This is why we have different parties with competing objectives fighting it out, is so that the end process, or the end result, is broadly satisfactory, even if the process is a little ugly.
Egon, I'd like to ask you about the timing, given that, as we were saying earlier in the show, record case counts. Is this the right time or the worst time to be asking the federal government to start looking for these documents?
Well, it's the only time for the Conservatives to call upon the government to pull out, as Paul points out, a fishing expedition, looking for any information that can keep the We scandal going, to keep the ongoing kind of concerns regarding the public concerns regarding the Liberal government involving some corruption. And all you really need is a little bit of smoke or an illusion of corruption. I think that this government's proven enough that people are suspicious of the way the government has worked. And one of our reporters at the Winnipeg Free Press this week, Dylan Robertson, identified upon doing research that the federal government has cut 40 to 50% of staff members who are working on access to information requests. That means that the media won't have access to information. That means that other parliamentarians won't have access to information. And that means that those who are working in releasing documents, it is 2 to 3 times slower, which was already a snail's pace process in order to get any information from this government. So there tends to be, as Paul pointed out, a lot of cutting corners, but those cutting corners really lead to a kind of a feeling of smoke and where's the fire?
Marty, I want to actually pivot in terms of what I want to ask you about in this discussion, because the other part of this broad discussion about health has to do with national standards for long-term care and when they're going to be set. The minister, in the interview we did earlier, seemed to indicate, let's face it, it's not happening tomorrow. It's not happening a month from now. She says there are ways that we can address these issues, but standards are a longer-term objective. What do you think of that?
Yeah, the standards are a longer term for everywhere, and specifically here in Quebec, the idea of the minister trying to impose, or the federal government trying to impose any sort of national healthcare standards or any sort of long-term care standards on the province of Quebec, is they're in for a firefight. I mean, that's like one of the it's a provincial jurisdiction in general, and it's something that's it's a very big political hot potato here in Quebec. You can kind of see why she's punting the ball down the road a little bit to dampen expectations.
Do you think they're meaningful? Like, would that be meaningful in your opinion? Like, these national standards, are they? I don't think anyone's arguing they're a silver bullet, but is it something that there is a pressing need for, given the deaths we're seeing, or is that just not the fastest road?
There are provincial standards right now. There are provincial standards in Quebec for long-term care. There are provincial standards in Ontario for long-term care. CBC has done some work on that in the province of Ontario, and you can have all the regulations you'd like. It's enforcement that counts. And as we've seen in terms of the deaths here, I saw the numbers the other day. Here in Quebec, it's something in the order of 85% of the deaths have been taken place in long-term healthcare facilities. So to answer your question, it's certainly not a silver bullet, and it's not anywhere close to even being a bullet when you don't have any sort of enforcement or political will to deal with the situation.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.